In this video, I will give you all the necessary details about keto diet, and by watching the video you will be able to take right decision about it. Please like it and subscribe the channel to get more informative videos. The keto diet is commonly promoted as a weight loss miracle, but it is essentially a medical diet with major hazards. The ketogenic diet, sometimes known as keto, is a low-carbohydrate diet that promotes weight loss. 70% of calories coming from fat, 5% from carbohydrates, and 25% from protein, earning it the nickname LCHF, low carbs, high fat. The most common reasons to avoid the keto diet: carbs or glucose are used by the human body to perform daily tasks. However, because this diet is low in carbohydrates, the body uses stored fat to produce ketone. Among the potential keto hazards are: you may be deficient in micronutrients such as selenium, magnesium, phosphorus, and vitamins B and C if you don't eat a wide variety of vegetables and fruits. The diet may aggravate existing liver issues because there is so much fat to process. The kidneys assist in protein metabolism. Nevertheless, the keto diet may overburden them. The brain requires sugar from healthy carbohydrates. Low-carb diets can cause irritation and disorientation. Because acetone is one of the ketone bodies, a keto diet might result in stinky breath. During the changeover phase, your body will suffer flu-like symptoms as it transitions its source. The majority of the weight you lose in the first few weeks is due to water loss rather than fat loss. Headaches, tiredness, nausea, and thirst are some of the symptoms you'll experience. Hypoglycemia, or low blood sugar, is another diet adverse effect. This adverse effect manifests itself as shakiness, chills, sweating, hunger, and exhaustion. A side effect of the keto diet is sleep disruption. Sleep deprivation can lead to irritability and difficulty concentrating. Excessive fat consumption can raise cholesterol and lipid levels. Constipation is a common side effect of the keto diet due to the drastic change in nutrition and dehydration. Some persons may have diarrhea as a result of their high-fat diet. Acidosis increases the risk of bone fractures and damage. The fact that acidosis causes an abnormal loss of salt minerals in the bone, resulting in bone demineralization and erosion. Women's menstrual cycles are disrupted, and in severe cases, menstruation is absent. Ketosis can cause a drop in urine pH, which can lead to the formation of kidney stones and crystals. Anyone who are at risk of developing heart disease or kidney damage, nursing or pregnant women, and those who have had their gallbladder removed should avoid the keto diet. The ketogenic diet has the potential to harm your health. Before embarking on a ketogenic diet, consult with a physician and a licensed dietitian.